Good evening, everyone. How are you guys doing? You're still here. You're the last of the Mohicans over here. I'm excited to talk to you today. I just came from San Francisco last night by way of Austin, and I wanted to start with a story. About 20 years ago, I was driving an ice cream van, a beaten up 1982 ice cream van. It had painted on the side, Fat Lucky's Ice Cream, and it had all of the popsicle menu items on the van, and it had no chairs in it. I was on tour with my band, and we had no money, and so we could afford $500 for this van, and we used lawn chairs to ride in this van, so there were no seat belts, just lawn chairs in Fat Lucky's ice cream van, and we would play shows all over the U.S. in this, but it would keep breaking down, and it also had the freezer was still in there. We couldn't figure out how to get the freezer out, so 2-year-old ice cream in the freezer after long, drinks and long nights, somebody would accidentally open the freezer and, nobody could be in the van for the next half hour or so. And I remember the last time I drove that van from Louisiana, we were heading to Texas for another show, and the van started smoking, and that smoke eventually turned into fire. And we pulled over and we started scrambling to get all our gear out, and we just watched our Fat Lucky's ice cream van go up in flames, and while the fire trucks came. And, we soon learned that we maybe needed some more reliable transportation to be able to tour. And we eventually started learning from our mistakes. And I ended up, we got a nicer van. I ended up signing a very large record deal and having a couple of top 10 hits on the radio in the U.S., touring all over the world, had a top 10 video on VH1. And you never would have known that we were in this shitty ice cream van at one point. But it was a broken system, and it took us a while to figure out what was broken about our current environment. At the height of my career, I'm touring all over the world. I get married. I have 2 beautiful girls, Weston and Rose. Weston's now 12 and Rose is 10. And Rose was born different. She starting to miss developmental milestones. She would choke on her food. I would have to give her enemas. I don't recommend giving anyone an enema, but it was the only way to relieve her of her constipation. And then when we tried to teach her how to walk, she would start walking, then she'd fall flat on her face and just bust her nose open. About 18 months, she started speaking. She could say mom, dad, and outside. And she eventually lost her ability to talk. And so we didn't know what to do. We ended up figuring out that nobody tests for diseases that don't have treatments, at least at that time. And so we found GeneDx and ran a whole exome sequence, which cost about $10,000 at that time. Now it's about, $250. And found that she had a mutation in a gene called the HNRNPH2 gene. And I didn't know what that meant. I took it to the pediatric neurologist, and he looks at me and he says, Casey, your daughter has a rare disease. There is no cure. There's nothing we can do. Good luck. So, as a parent, I realized back then that I had reached the dead end of our healthcare system. As a consumer, we think that, medicines are magic and there's a cure for everything that ails you. But the veil had been pulled away, and I saw that there was no treatment for Rose. And so why was there no treatment? So I began to, I'm her dad, so I would do anything to save my daughter. And so I began to, I did what any smart person would do, and I Googled parent cures child of rare disease. Because I figured, too bad we didn't have AI then, I probably would have got more results. And I found this mom, Julia Vitarello, who had developed an antisense oligonucleotide with Dr. Tim Yu at Boston Children's, and they went from diagnosis to treatment in less than a year. I'm sure you're probably familiar with the baby KJ story with CRISPR. And this was before baby KJ. And so I Facebook messaged her and asked her if she would teach me how to do this. And she connected me with Dr. Tim Yu and started connecting me with other scientists. And I think I talked that first year to, 200 or 300 scientists, biotech CEOs, drug developers, CROs, academics. And I learned something really profound, is that, Rose's disease only has about 140 known patients globally. And I learned something of that most rare disease is genetic, and most genetic disease is ultra rare, especially in the CNS. And so you're looking at near 500 million people that most likely will never see a treatment, not because the technology doesn't exist for some of those diseases, but because the systems and the business models do not. And so I kind of had a choice. When I learned that, it was profound to me that drugs cost near $1 billion to develop, take 10 years to do it, and they have a 5% chance of success. I thought, man, this is just like the music business, except a few less zeros, So I had a record deal from Sony sitting on my desk, and I kind of had to make a choice. Do I go and try to help Rose, or do I just go about my life? Raising a special needs kid is a very difficult thing. It takes everything you have to give them everything that they need. But Rose is interesting. She can't talk. She struggles with walking. She has seizures. But she gets up every day with a determination and a courage that inspires me. If you've ever been around a suffering person, someone that is terminally ill, knows they're going to die, someone in pain, they end up with this, not always, but often end up with this level of courage and grit and tenacity that is really inspiring. And so I decided to quit my day job of being a rock and roll singer, and then got on YouTube to start learning genetics. I became good friends with Emil Kaukas at Ultragenics and Neil Kumar, BridgeBio, and the John when he was at Amicus and other, rare disease biotech companies. And I started a foundation and raised millions of dollars in the foundation, but realized, that's not a sustainable way to do ultra-rare drug development. And I tried to use academia to make a drug, but they own everything, and most of those drugs all get shelved because they're too small. And then I tried to use CROs, and no offense to some of you wonderful service providers, but it was a very transactional. A long-read sequence costs like almost $10,000, and when I found out that $10,000 in 6 months, when it really cost about $1,200, and it took about a week. So that same urgency timeline didn't work for me and for what I was doing for Rose. So we started a lab in Texas about 5 years ago, and some scientists quit their day jobs. They had put many drugs into the clinic before for big biotech companies, with the idea that could we develop a system to make these genetic treatments faster and cheaper. And so we started with antisense oligonucleotides because they were cheap to make easy to design, and they were working in the clinic. And we made an ASO, preclinical ASO for Rose. Then other families started contacting us, and we made a gene therapy. We used AAV9, Lenti, dual vector. We started working with different vector approaches, and they're working in these cell lines. They're working in animals. We started doing repurposed drug screens, and some of the kids now are on some of these repurposed drugs and seeing efficacy, seeing at least a slow of their disease. And we developed this model that was literally pennies of what most academia and CROs were charging, because we're talking to the families, monthly about the program. They're paying for it, and then they own all the intellectual property. And once we started building these treatments, and we had an ASO for Rose, and I really fell in love with antisense oligonucleotides because they fit a model for ultra rare that doesn't exist right now. If most genetic disease is too rare for our current business model, then we got to come up with a different business model. Could we sell a bunch of tiny drugs? Could we make them for less than we sell them for? Could we move closer to personalized medicine this way by having an engineered system? So we created, after that lab, Rare Labs, we created AlphaRose Therapeutics, which is a public benefit corporation, a couple of years ago, and we took in the lab, we took in Rose's ASO, which we've trademarked as McPherson, and we bought a proprietary ASO chemistry we think is going to be better. We've been developing systems and AI and technology to go faster for these patients. And I bought a custom suit and got rid of my ripped up blue jeans and a t-shirt and became CEO of a biotech company with 15 employees. And we're hell-bent on creating a new business model for these ultra-rare genetic diseases that are amenable to technologies that work today. And lastly, if I raise enough money, we'll be taking Rose's ASO into the clinical trial this year and treating her, which I'm very excited about. As artists, we like to exist in chaos. We prefer places without rules, and we create order out of that chaos. It's kind of how you write a song. It's how you draw a picture, paint something. And oftentimes what happens is that order begins to function in a way that the rest of society lives a better life because of that order. But initially there is no order. It's all chaos. And what I've noticed about the healthcare industry as an artist coming into this is it is full of rules. Yeah, we're dealing with human life, but the word SOP, SOP was the first time I'd ever heard it until I got into this. And now we have hundreds of SOPs. We use an IRB. There's more acronyms in this business than there may be real words. And it can be very hard to think outside of the box when you are inside of a system that is built to be able to provide safety, regulation. There's so many reasons why having rules is important in medicine, obviously. But our current system is not working for a lot of people. And so I think often about how do we, as a group of people, change the model? How do we make it better? I used to identify as an artist. Now I identify as a biotech CEO, but mostly as Rose's dad. You could call yourself a conference. Maybe you work here at the conference. Maybe you're a scientist. Maybe you're a BD guy at a CRO or BD gal. Maybe you're an investor. But I think what I've realized is that in this business is one of the most special businesses in the world. Because you get to be a miracle worker. You get to save lives. You get to bring people hope that have none. You get to change an entire generation of people with a treatment. And whether you're the person that's, selling the 96 well plates, or you're the person that's filling out that very long 1,000-page IND, every single part of what we do for this process gets us closer to a treatment. It's clear to me, though, that we have to go beyond our titles. We have to go beyond this calcified system. And it means that we need to be able to possess a North Star, that there are patients and dying and suffering people at the end of everything that we're doing. It creates a completely different kind of urgency, and it creates a completely different kind of innovation that every single person in this business has the ability to do. You don't just have to be some crazy rock and roll guy in a band. In fact, you have more of ability to do it than I do because you have more knowledge than I do. But it means, I think about this a lot, that we need to have the ability to give up the identity that success is found in just following the rules and playing it safe, because it's scary to go outside of what we know. I started AlphaRose with some ex-executives from a company called Genzyme. You guys familiar with Genzyme? See some heads nodding. So Belinda Termeer, Henry Termeer's wife, is my co-founder in my company. And Alan Waltz, who is his business development guy, is my executive chairman. He's basically my boss. I didn't realize just because you're CEO doesn't mean you're actually boss. But Henry had this idea that if you focused on the patient and you built all your technology around it and you built all your systems around it and you focused on treating them with urgency, that the revenue would come, that the success would come. He would even go so far as to say the universe would reorganize itself to help you. And it did for them. They sold for $20 billion to Sanofi. They used to make fun of him. Big-time pharma companies would make fun of this guy. You're never going to commercialize a rare disease therapeutic. You're never going to change the system. And they did. And look how many incredible technologies and companies and services have come out of that. I think I'm such a proponent for innovation because my daughter's life has been on the line because of the lack of it. And she has hope because of the desire and the activity, the execution of it. And so, I think we have our daily choice as people in this very large healthcare system in every place that we're in is, are we going to choose to just do things the way it's always been done? Play it safe. There is a roadmap for that. Or are we going to pull deeply from ourselves, from that higher purpose? Are we going to risk to pull in the innovation, the change, the evolution of healthcare so that patients get better treatments, so that our globe is healthier? Some of you might be going like, oh my God, this feels like a church service. Or it's too gushy. And you don't see the value because it's science, and there's a tendency to try to take the emotion out of it because there's a lot of suffering. So it's easy for us to kind of create this walls. Doctors have been trained to do it for, decades. And I get it, but I'll say this, it is extremely difficult to be self-aware enough to balance your purpose of why you are here and the practicality of executing that in an environment that is imperfect, that is full of bureaucracy and difficult to, there's so many things, right, that work against you when you're developing a treatment. There's so many difficulties, but there's two quotes, two guys. There's a guy named C.S. Lewis who'd say, peel back the onion. So I think if you start with peeling back the onion in your business, whatever that is, or your lab or your company, and you look at, is this serving the patients? Can I do this better? Is there a faster way for me to accomplish this? Is there a more affordable way for me to do this? And then, Thomas Merton said, are we willing to take off the masks? And so is there a world in which we could innovate because our priority isn't just financial success. Our priority is success for the patients. I am a firm believer that everybody has the ability to be creative. And so, as you leave this conference, I'd love to challenge you to take this next year and consider yourself that hope giver, a change maker, that miracle worker, and act in that spirit for patients instead of the fear of failure or the fear of success. Now, I'm not really great at pitching, and my science is still getting there, and so I still play music every now and then, even though I don't tour, and it's not the business I'm in. But I wanted to leave you with a song that I wrote, and I wrote it about how I believe that true connection can be a powerful motivator, a powerful driver for this type of innovation and change. If you think about you need inspiration, go meet a patient. Go sit with them. Go talk to them. Get messy. And that connection, that rawness is enough to give you the fuel that you need to take the risks that you need. And sometimes just being connected to my daughters is all I need to get my ass off the ground and do it again. But I'm also still the guy that drove the ice cream van. I'm a single father to a special needs kid. Oftentimes I'm overwhelmed. I'm changing another diaper on a 10-year-old. I'm worried that I may find a dead child in her bed from a seizure the night before, wishing she could say daddy again. But all the while, I'm also the one that's created a genetic treatment for her, running a multi-million-dollar biotech company with the intention of changing medicine forever. But it's just because I really want to save Rose and the kids like her. That's it. And I want to see this happen before I die. And I think we probably all want to see these changes happen before we leave this place. And so, this kind of imposter syndrome happens when you are taking risks. And I think it's important to remember that if you're here in the job that you have, doing the work that you're doing, that you are enough. You are enough to take the challenge and the risk on to change medicine in the area that you are in. And so that's what this song is called. Aptly named Enough. No one's ever called me like a real happy speaker, just so you know. You getting that? I wake up in a cloud, rush to get us out. Tie your shoes and make your lunches. I wish I had a little help. I'm afraid that I will fail. Forget something important like your homework. I just want you to be safe. Never feel this world's pain. But I know it's unrealistic, 'cause you deserve my best, but it's putting me to the test. Guess I'm scared it's me you'll mimic. I know what you want, 'cause I want it too. Just to be close, close to you. I hope that I'm enough to help you be free. Sometimes I'll save you, but sometimes you save me. I spent all the day trying to make a way to fix your disease, give you your voice back. It's so easy to forget the life we could have lived if all this shit hadn't happened. I'm just afraid. Will it mean I can't be king? Will it take all my dreams away? Will it kill something deep inside? Will I fail or screw up your life? I know what you want, 'cause I want it too. Just to be close to you. I hope that I'm enough to help you be free. Sometimes I'll save you, but sometimes you save me. Regardless of my goals, I want you both to know my best ain't close to perfect, but I give you all my love. Making you is loving enough. While we keep on searching. May this be an awesome year of innovation for all of us. Thank you, Facilitate, for having me.